Hi, I am Dr. Rahul Reddy, and today I'll be explaining you regarding how to use an insulin pen. If you can see here, this is how an insulin pen looks like. This is a pen cap, and here you have the insulin reservoir, which has the insulin in it. And this is the tip of the pen where the needle is attached to. Here on different pens, you have the dose window at different places, and at the end you have an injection button. If you press, the insulin is delivered to the child. Now, what are the first few things that we should look for when we take an insulin pen? We should check its expiry date. We should see that we have enough pen needles to attach to the pen. We should have an alcohol swab, and also we should have a plastic container where we can dispose the sharp needles after use. When you use the pen, first you should wash your hands and make sure that you're doing it under sterile conditions. We should remove the pen cap and check the insulin name on the reservoir, or if you're using a cartridge or a pen fill, check the name on it to make sure that you're giving the right insulin. Then you should wipe the tip of the pen with an alcohol swab to keep it sterile, and then attach the pen needle. After attaching the pen needle, you should pull the cover and remove the needle cap. You should remove the air from the needle by doing priming. Priming is nothing but you dial on the dialer to 1 or 2 units and hold it up like this, and the needle should point upwards, and then press the injection button so that the last drop of insulin is seen here, and it comes out. After this, the dosage goes back to 0, and as per your child's requirements and the doctor's instructions, you need to again dial the insulin dose that you want to deliver at this time, turn the knob to the required units, and inject the insulin at the different injection sites, which will be explained to you in another video. With one hand, hold the pen such that the thumb is free to push the injection button. You can hold it in such a way that you can see the dial, and you can see that it goes back to 0 when you press it completely. With the other hand, you should pinch the skin around the injection site and insert the needle and the pen at a 45 to 90 degrees angle. After you insert it fully and press the injection button, please count for 5 to 10 seconds so that even the last drop of insulin is delivered and it doesn't come out. After which you leave your hand and remove the insulin pen. The last step includes removing the used needle by turning it, and then you should dispose it in a plastic container. At the end of the procedure, then you should again put back the pen cap and then store the insulin pen as per the requirements. With this, what we have seen today is we've seen regarding how the pen looks and what are the different components needed while giving insulin injection by insulin pen, maintaining sterile procedure, how to attach the insulin pen needle, and after which the most important step comes here, the priming, where you remove the air from the needle and then you dial the required dose and inject it in a proper technique and then dispose the needle safely. Thank you very much.